My name is Danielle. I'm from Ottawa, Ontario. That's in Canada, for those of you who don't know. And I got the lap band surgery yesterday. I don't know what the technique's called, but apparently there's going to be minimal to no scarring. Microsurgery, yes, and I was very, very pleased to hear that because, I mean, as I don't have such a high BMI, you know, like my skin's not going to be as loose. So when I do lose weight, I'll be able to maybe show my stomach, maybe wear a bikini, and I'm very excited for that. And I was worried because you might have scars all over your stomach, and then people would either know that I had it done or think something was wrong, you know. So I was glad to hear that there would be very little scarring. I heard about lap band quite a few years ago. It was advertised on a Canadian television commercial. I didn't think anything of it because, as far as I knew, it was only for people who were very, very obese. And I'm not obese, I'm overweight, you know, so I just kind of disregarded it. And then recently, over the past couple of months, I was looking for ways to lower my weight and try and make myself look a little better. And then I just did research for months and months, and then I found just an ad on the computer one day for the lap band surgery. And I figured that would be the best way to go. While I was doing my research on other things, I saw one from Ontario, and there was a little video saying, like, we can do it without any scars and things like that. And you know, I didn't think getting it done here that you would be able to do that, not realizing that in Mexico was where it was done a long time before Ontario, so I didn't even think of that. So I was just once again very pleased to hear that. I'd been thinking about it for such a long time, and then I just kind of made the decision, you know, get your passport. The second you get your passport, you make a call. I made the call, and within 2 days my appointment was booked, and that was actually the next week. So I was actually booked a week later, which was very short notice, so I had to do everything as quickly as possible. And then, you know, I got on the plane really early in the morning, and then I got picked up and I got here, and everyone was so friendly. I met some people. Sarah, really nice girl, I met her yesterday. We've been hanging out the whole time. She's originally from Australia, but she's coming from Korea. So she's got a Japan, sorry. Yeah. Yeah, she's got like a 25-hour flight tomorrow. I don't know how she's going to do it. Mine's quite short in comparison. So, but the whole procedure was great. Like, I mean, I went for a 2-hour walk today with Sarah, and we just had our surgery like maybe 24 hours before. We both feel great. We're a little tired towards the end, but that's, I'm sure, to be expected. And we both feel good. Not even really hungry. It's completely different. Like Canada has, we've got like free healthcare, so I could just walk into the hospital and say I have, you know, I have a cold, or, you know, I broke my leg, help me, and they will help you. But like this is an 8-hour wait probably, and you know, everything's just kind of basic. It's just a couple chairs, you know, you check in, nothing's all nice. Like this place is beautiful. It's absolutely gorgeous. It's like being in a spa. Like everything's decorated, everyone's so friendly, people are there to explain things to you. The anesthesiologist actually came into a room last night at like, I was like 8:30 at night, and I know he had been here since earlier in the morning, and we just chit-chatted for like 20-25 minutes about the surgery and what he does and just general things, just about life, you know what I mean? I was really impressed because it's very rare for a doctor in Canada to do that and have time to do that and give you that special attention. So very good experience. I was using, I was just going on the forums and things like that, and I was actually going to go with another doctor, and then I found some things online that weren't very good to me, and then I was like, okay, I'm just going to look at other doctors, and I saw Ortiz's name come up over and over and over again. So I actually went in and tried to search for something bad for Dr. Ortiz, because I was like, it's too good to be true. This guy literally has nothing bad in anything said about him. So I was actively looking for something bad, and I did not find anything bad. So I mean, if I couldn't find anything bad and there was other doctors I could find that were bad, then he was the way to go for me. He was very trusted, and everyone who was online said very good things about him and the rest of the staff. So I really couldn't go any other way. Well, one concern I did have was actually coming to a place that I didn't know, especially myself. I've been to Florida when I was 4. That was the furthest I went from home. So coming all the way, you know, crossing the border, coming into Tijuana, I was pretty petrified of what was going to happen, who was going to be there, what the people were going to be like. But as I said before, everyone was very, very polite, very friendly. You know, even if we didn't really understand each other, like even at the hotel or whatever, people would just smile anyway. So really everything that I had worried about wasn't so bad. Like the first night I was there, I was like, I'm staying in the hotel, I'm not going anywhere. But I mean, I went for a 2-hour walk today, you know, and went to the mall and I had no problems. It was like, if you think about Canada, it's like being in Toronto. It's like being downtown Toronto. So if you've been downtown Toronto, it's the same thing.